We chose to do mouth rinses.
Some major brands include Oral-B, Listerine, and Scope,
as well as Colgate, Cepacol, and Sensodyne.
There are many different ingredients in mouthwashes. There are antimicrobial agents that act directly on oral bacteria to help reduce plaque, decrease the severity of gingivitis, and control bad breath.
Fluoride helps reduce tiny lesions, such as tooth decay, on tooth enamel and makes teeth more resistant to decay.
Astringent salts can serve as temporary deodorizers that mask bad breath.
And odor neutralizers act by chemically inactivating odor-causing compounds.
All of Listerine's mouth rinses contain the first 3 ingredients listed below.
Eucalyptol acts as an antibacterial and antifungal agent.
Menthol contains germ-killing properties and helps prevent growth of bacteria in the mouth.
Thymol has antiseptic qualities that help fight oral infection while decreasing the risk of gum disease and bad breath.
Sodium fluoride is used for treatment of bad breath and cavity prevention.
And zinc chloride prevents cavities.
Scope Classic has no medical active ingredients in it.
Crest Pro Health is alcohol-free and its active ingredient is cetylpyridinium chloride, which is an antiseptic that kills bacteria.
So there are many different places where you can buy mouth rinses. We checked out Rexall, Walmart, and Shoppers Drug Mart. Walmart was definitely the cheapest for all of the different mouth rinses. We found Listerine was usually the most expensive at all these places, and Scope was usually the cheapest. And we found grocery stores, they didn't have as many options to choose from as the Rexall or Walmart or Shoppers Drug Mart did.
And usually each drugstore has their own generic brand. Directions on how to use the mouth rinse is adults and children 6 years and older, you use after brushing and flossing. You rinse with 20 milliliters of mouth rinse, and you use this for 30 seconds twice daily. And you cannot eat or drink anything for 30 minutes after use, and do not swallow the mouth rinse. And here's a video of how to use the mouth rinse.
Now that you're done with brushing and flossing, it's time to give yourself 100% oral care by rinsing with a mouthwash. First, pour 20 ml of your mouthwash into a cup. And then, pour it into your mouth without diluting the mouthwash. Slowly rinse each portion of your mouth. Let's start with the front, keeping your lips tightly closed. Then move on to the sides, making sure the inside of your cheeks are reached as well. You must also gargle in order to reach the bacteria that settles at the back of your mouth, just at the throat. Keep a check on the time and spit the mouthwash after 30 seconds. Now, all you have to do is make sure you don't eat, drink or smoke for 30 minutes and you are on your way to 100% oral health.
So some marketing strategies that mouth rinses have are using sense of humor, and they also use facts to get their point across. Here are some ads on the screen here that they use.
And some of them are found on websites or in magazines or in flyers. And then there are some commercials as well.
Here's a video of a commercial for Listerine for kids.
Dear Mom and Dad, you taught me well, like how to stay clean. You taught me how to study hard, how to make healthy decisions, and how to stay safe up there. But brushing alone might not protect my teeth from cavities.
Listerine Smart Rinse cleans where brushing misses and provides stronger cavity protection than brushing alone.
That's better.
For stronger cavity protection, Listerine Smart Rinse.
So there's many different ways that they market mouth rinse. Dentists and dental hygienists make recommendations to their clients, and often the dental companies give these dental offices free samples that they also give to the clients, which is good. There's also many different commercials. Listerine actually had a commercial in a Super Bowl, so that's pretty cool. There's advertisements in flyers, magazines, and websites, and they advertise mouth rinse as an addition to people's everyday routine alongside flossing and toothbrushing. So they advertise it as just as important as those two things.
Here's some additional advertisements.
As you can see, they usually use it for bad breath because it's an embarrassing thing, and they try to make humor out of it. That's how they market.
So why use mouth rinses? Well, it freshens your breath.
It helps prevent or control tooth decay.
It reduces plaque.
Prevents or reduces gingivitis.
It reduces the speed of tartar buildup.
Pre-procedural rinse helps reduce bacteria levels.
And some can help whiten your teeth.
So there's cosmetic and therapeutic benefits. The therapeutic benefits can help reduce plaque, gingivitis, cavities, and bad breath, and they fight the bacteria present in plaque.
Then there's cosmetic, and they temporarily control or reduce bad breath. They leave the mouth with a pleasant taste. However, they do not deal with the causes of bad breath. So they do not kill bacteria associated with bad breath or reduce plaque, gingivitis, or cavities.
So what is the target audience for mouth rinses? Well, Biotene mouth rinse is recommended to patients who have bad breath to help lubricate the tissues. Or dry mouth, sorry.
And
Dry mouth, okay.
dry mouth, yeah. And Listerine and Oral-B offer mouth rinses for children.
There's whitening mouth rinses on the market that's directed for people who want a cosmetic benefit.
And zero alcohol for people with dry mouth and also have substance abuse.
And generally, mouth rinses aren't directed towards children, as they shouldn't use mouth rinses if they're under the age of 6, and they need adult supervision between the ages of 6 and 13.
So there's a lot of research that's been conducted. Canada has the Canadian Dental Association SEAL program, which has a symbol that identifies oral health products that are beneficial to consumers, and it is the red seal that you see on the left there.
And America has the American Dental Association Seal of Acceptance, which is considered the gold standard when it comes to evaluating the safety and efficiency of dental products, and that's the green stamp on the left there.
So if products have either of these seals on them, then their effectiveness and the claims that the companies have made have been backed up with research.
On the CDA product approval list, Listerine has 17 of their mouth rinses, Periodex has 1 mouth rinse, and Crest has 2 mouth rinses.
So a study done between Listerine and chlorhexidine mouth rinses both showed significant reduction in Streptococcus mutans in teenagers. This study was a bit biased because it was done by Johnson & Johnson, a company which owns Listerine.
There was also a study done that showed the essential oils in Listerine's antiseptic mouth rinse accomplished deeper penetration of stain and exhibited superior biofilm kill in the mouth versus the competitive mouth rinses that contain cetylpyridinium chloride or chlorhexidine, and this was a third-party study.
A study showed that mouth rinses containing high bioavailable cetylpyridinium chloride reduced the plaque level by 15.8%, gingival inflammation by 15.4%, and gingival bleeding by 33.3%. And this was a third-party study, so it wasn't biased, and as you can see, very, very good results.
Our recommendations are any product that has the CDA seal.
And we'd recommend any product listed on the CDA product approval list.
We would recommend Listerine as it has 17 products on the CDA approval list, so there's many different kinds to choose from to suit your individual needs or the client's needs.
Listerine also conducted the most research to back up their claims. Thank you for watching our presentation of mouth rinses.
Thank you.